I also had a wonderful home birth, and every minute of it, I thought, this is awful. I hate this. I want this to be
Yeah.
over. I never want to do this
Yeah.
again. And my daughter came out with cranial nerve dysfunction, and like she didn't feed very well.
Wow.
And
Wow.
she's got some issues with her teeth now. She's 6, almost 7. And I know that
Wow.
that's from the way she was born.
Before we dive into today's episode, we wanted to let you know about 2 upcoming Skills and Drills workshops with Augustine Colebrook in Spokane Valley and Fresno in February and March 2025. Skills and Drills is an immersive, round-robin training experience featuring 18 hands-on skill stations, lifelike models, and expert guidance from Augustine. Whether you're refining your technique or learning something new, this is the perfect opportunity to practice in a supportive and high-energy environment. The skill stations cover everything from phlebotomy and newborn exams to suturing, breech maneuvers, and so much more. Spots are limited, so please head on over to midwiferywisdom.com to register before tickets sell out.
Hi, how are you?
Hi.
Thank you
I'm
so
excellent.
much
How are you?
for doing
Absolutely.
this. I really can't wait to hear all of the insight that you have to share today. But before we jump into the content, let's do intros. Tell me who you are, where you are, and what you're all about for our audience.
Absolutely. So my name is Meaghan Beames. I am a registered massage therapist. I am a craniosacral therapist, rhythmic movement specialist, visceral manipulation, and I live in Toronto, Canada. Yeah, I do all the things. I work with
Wow.
babies, toddlers, children, teens, adults, grandparents, everybody.
Amazing.
Yeah.
And so I think some of those trainings, certifications may be familiar to our readers, but in case they're not, let's go a little bit deeper into what craniosacral is and
Sure.
any other
So
trainings you want to talk about.
absolutely. So craniosacral therapy is a very gentle, hands-on healing modality where we find areas of the body that are tight and we use 5 grams of pressure. It's very, very minimal amounts of pressure to find those areas and also minimal amounts of pressure to help release those areas. So generally speaking, when part of the body is tight, it can throw off our different bodily systems. So like our respiratory, cardiac, our digestive, all of those things can be altered due to tight fascia. So if you don't know what fascia is, it is the connective
Yeah, I was going
tissue.
to say, here's another definition. This is
Yeah.
very important. Yeah.
So if you, let's say, we'll go with the vegan. If you're vegan, or if you've ever peeled an orange, so we've got the skin of the orange, and then you have the individual slices of orange. That wrapping around the individual slices of orange is essentially fascia for humans. And so it
Yeah,
is
or we could do the
connective.
carnivore view, which is all the white stuff you peel off the chicken breast, right?
Exactly. And so if you do the
Yeah.
carnivore and you're cutting through it, it's like, wow, why can't I cut through this layer? It's so tough. And so that is fascia. But fascia, again, is a connective tissue. It is tough, but it's malleable, meaning that it can get really, really tight, but it can actually loosen. So it has those qualities to it. And that wraps around our muscles, it wraps around muscle groups, it wraps around our bones, our nerves, it wraps around our internal organs, everywhere. So we could be tight around the intestines. We could be tight around our left ankle, and it can throw off bodily systems. So,
Totally. It's
yeah.
like the last frontier in the human body. Like people just didn't really get what this was about until it feels like just a few years ago.
Fascia used to be discarded when it came
Yeah.
to cadaver labs. It was like, what is
Yeah.
this piece of waste? Let's go throw this out. What they're finding is that fascia is incredibly intelligent. It
Yeah.
can store memory. So they have found memory cells within fascia. I believe also memory cells in the liver. So they're finding lots of different important qualities of this fascia that craniosacral therapy has known for since the 70s.
Definitely.
And so we are working really, really hard to get this information out to people because let's say you had an injury. So people are like, well, how can it get tight? Let's say you had an injury, a slip and fall on the ice. That's all it takes. or you slide down the stairs and you bump your bum on the bottom stair. Yeah, that's all it takes to get some tightness in your fascia. And so let's say you do that
Also,
when you're
doesn't
like
it like
13.
repetitive movements
It could
too?
be
Like
repetitive
repetitive
movement.
movements, things you do over and over. So like
Correct.
the right side of many people's bodies, in the United States where they drive with the right foot usually,
Yes.
like that
Yes.
that is a commonplace too, I've heard.
Yes, it could be typing. So your arms, just keeping them in one stationary position and typing your fingers,
Mm.
right? Joints of your fingers, they can get tight, and that tightness will travel up your arm to your shoulders and then up your neck to your head.
Mm-hmm.
And so this
Mm-hmm.
fascia is connected everywhere. So it could be repetitive strain, like you said. It could be an injury, like blunt force, so falling. It could be traction. So maybe you
Mm-hmm.
got your arm is dislocated or something like that. Or somebody, maybe you're walking your dog and they pull you really, really hard, really fast. That type of thing. So these small things that we think are, benign could actually have an effect on our body for years and years after if they're not addressed. Right. So some people go to a chiro, they go to physio, they go to massage. And sometimes, yes, we can address them. And sometimes, no, we can't with those types of modalities. Fascia can release through heat, it can release through movement. And sometimes it can release just by being witnessed, just being like, I see you're tight. Would you like to change? And that's where craniosacral therapy comes in.
I had a craniosacral therapist back in the day who used to work at one of my clinics. And she used to just say, like, just remember, we're the reason that witches were burned at the stake.
Yeah.
We're
Oh, I am
magic.
a total witch.
Yeah, right. Well, I mean, it's just like what you said. It just feels so counter culture to say that just being witnessed or
Yes.
5 grams of pressure is enough to say a level of communication that allows anything to shift, let alone a structure in your body, right? It feels like magic. And yet if you've ever been on a craniosacral table, you know what this feeling is. It is
Yeah.
like magic.
So
Mm-hmm.
fascia is protective tissue, right? It is
Yeah.
reactive tissue. And when
Yeah.
our body does not feel safe, it reacts, fascia reacts. So
Yeah.
being witnessed and being in a safe space, this very intelligent tissue can say, okay, I can let go now. I'm safe.
Mm. Mm. Yeah. Well, you've brought up this very important piece, and I know there's new research showing that there are nerve, memory, brain cells like in the fascia itself. Like it is a highly intelligent organ, and there's just evolving research all the time. But
Mm.
we can even just get a felt sense of that ourselves in our own body when you imagine that the places where you have trigger points, knots, pain in your specific pain points in your muscle, if you press on it really vigorously, trying to release it, actually your body has a protected, like it won't let it happen. Whereas if you have soreness in a muscle from use, it almost feels good. You're like, yeah, rub that part that hurt. Yeah, get into that part that I used, as opposed to this fascial bind. So explain that process to us a little more.
So muscle has its own reactivity, right? It is contractile tissue, but it also relaxes. You and volitionary, right? You can say, okay, you're relaxed now, right? Like you can finish your job. Whereas fascia doesn't have that volitional, you can't be like, okay, fascia, relax now, right? And so sometimes a muscle is tight because the fascia is tight. And so the muscle within a muscle, it actually has muscle spindles, right? So they've got long striations of muscle, and those individual tiny little pieces, right? Like if you think of, again, we're going to go to carnivore. Let's say pulled pork, right? The pulled pork that is surrounded in little, like very, very thin fascia, and so sometimes I'm a massage therapist. Sometimes we can do some like deep tissue, right? Or we can do some stretching. We can do some gentle massaging, and the muscle, the actual muscle fibers, not the fascia, muscle fibers will make change. They will be like, oh, that feels nice. And so we're going to get to the muscle fibers, but that doesn't have an effect on the fascia. And so those injuries, let's say from 15 years ago, they can still challenge you 15 years after because they are still
Yeah.
protective. They're still stuck in that state. So that's why, a massage
Yeah.
can last for a few days, or chiro can last for a few days, and then it comes back because the fascia hasn't been addressed.
Yeah. It's such the future of body work, I think, is to really understand the fascial component. And in fact, there are many body workers in the birth work space that are starting to incorporate this knowledge in pregnancy, delivery, all those pieces. You have a focus on that as well. Newborns, tell us what your specific focus is.
Yeah, my main clientele. So I have a private practice in Toronto, but I also educate health practitioners on infant craniosacral therapy. So I
Yeah.
mainly work with newborns. The majority of my clients, I would say, are up to 6 months. And then, I definitely treat other age demographics, but the majority are newborns to 6 months. And we are working with things like traumatic birth experiences. The word trauma, people think, oh, it's got to be really bad, but it doesn't. It could be rose petals in a bathtub. And that is still being born is a traumatic experience for these babies. So we look at birth
Yeah.
from the infant
Yeah.
perspective.
It's challenging to say that all birth is traumatic, but I think it is accurate to say that any birth can be traumatic.
Any birth can be traumatic. And trauma could be like, ouch, I hurt my head. In the medical field, that is called a trauma.
Yeah, we talk about it like big T or little t trauma. Like what happens to one person might be really relegated as memory and not stay up and present in the body or in the psyche. But some people, it's big T trauma and it stays up very much for a long, long time. And we can't judge that from the outside. Like you said, like you can have a groovy water birth with rose petals and both mom and baby can be traumatized.
Absolutely. Absolutely. Yeah. And so from the outside perspective, it's like, that was a really great experience. And from the inside, both are like, wow, that really sucked. I hated everything about that. And
That's
who are we to say
possible.
what
I think that's
you
an
should
important
feel?
thing to say. Yeah.
Absolutely.
Yeah. I had myself, I had a really groovy home birth and I was really, really traumatized by it. And I think I've always walked into midwifery with that inner knowing. And I really appreciate that you said that. That really means a lot.
Yeah. I also had a wonderful home birth. And every minute of it, I thought, this is awful. I hate this. I want this to be over. I never want to do this again. And my daughter came out with cranial nerve dysfunction, and like she didn't feed very well. And she's got some issues with her teeth now. She's 6, almost 7. And I know that that's from the way she was born.
And sometimes the opposite can happen where mom loves their birth and baby is hysterical and colicky and not doing well. So give us some examples of where providers or parents could see the newborn and say, there's a thing here. Now, I personally think all babies should go to cranial, but let's say that that's not feasible or normal in a practice. Like what are some really important warning signs to pay attention to?
Yeah, I agree. Every baby deserves cranio after being born, but top warning signs I would say are the first latch. Either the baby it's already painful, or it's weak, or they can't even find it, or they're too sleepy. So first latch experience, if there's something even just a little bit off, I would say go see a craniosacral therapist. We're going to get this going on. Parents don't need to 3 or 4 days after birth being like, my baby still isn't latching. If we get to see them within the first 24 hours, we can avoid so many issues.
That newborn breast crawl actually shouldn't be rare. That's normal.
That's right.
So if we're not having that, we have something going on.
Yeah, that's a sequence of primitive reflexes that the baby is supposed to go through. Supposed to, if the birth is unhindered. Now, I'm not saying that if they don't go through it, everything's ruined. It's just that we're kind of getting in the way of these types of things. And so that would be a warning sign. Another would be, let's say the pushing phase is greater than 30 minutes. That tells me there's something going on in the pelvis. Perhaps there's the baby's head is slightly off to one side, so asynclitic, or just
even with primates.
Oh, yes, absolutely. Yes.
Okay. It's standard wisdom that it's like normal if you push for 3 hours. That's a no-go for you.
No, so I've treated nearly 900 babies, and the majority of them are primates. And there's lots of babies who I see who have had 30 to 45-minute pushing phase, and I'll see the same thing as if they had 3 hours of pushing. They will show me very similar signs and symptoms.
Mm.
And the majority of my clients are primos.
Interesting.
Yeah. So greater than 30 minutes. So the reason why I'm saying that is not because it's more trauma or whatever. It's that even the slightest bit of extended time in that birth canal can put pressure on the cranial nerves that go to the mouth. And so we can do some really gentle techniques soon after birth to help with cranial nerve functioning. Also to help with head shape. So the sooner we get to see them, the less likely those issues will kind of linger or perpetuate and get worse. So a longer pushing phase. Let's say the baby had a nuchal cord, a nuchal hand, shoulder dystocia, perhaps they were born cesarean, emergency cesarean, they, failure to progress, there were D cells. D cells to me usually means that there's pressure on the brainstem and the vagus nerve, and that
it depends on what type of D cells, because early D cells can just really be pretty straightforward. Yeah, late D cells are more associated with placental deficiency. Oh, so you were actually talking about early D cells. Yeah, okay. Mm-hmm. Okay,
yeah.
Interesting.
So, and of course, I'm not in the birth with them, but to me, when I see...
No, but it's fascinating. Yeah, it's really like the physiology of it. It's fascinating. Okay, keep going.
Yeah. And so when there are early D cells, usually I see a baby who has plagiocephaly or brachycephaly. So their head shape is off. So to me, I'm always thinking about the cranial nerves. I'm always thinking about what were those cranial bones doing? How were they being shifted? What were they being pushed up against? And what is the effect on the fascia? So remember that fascia surrounds everything. It surrounds the brain. It surrounds the spinal cord. It surrounds the cranial nerves that go to the mouth, the throat, the lungs, everything. And so I'm always thinking about what was the effect on the nervous system. So for me, D cells,
definitely.
D cells to me tell me about, especially when it's like, oh, with the contractions, the baby had D cells and they didn't rise up again. Okay, so why are they not rising very quickly? What's happening to that vagus nerve? Of course, again, I am not literally inside the womb during this experience. I'm just hearing it from, days later, sometimes weeks later. So I am just assuming. Yeah. But again, there's a huge correlation between D cells and a baby's head shape when I see it.
Yeah.
And they've usually got flattening either on one side or both, or on the very back. So again, if this is an experience during the pushing phase, then I would like to see that baby like within a week, minimum, maximum even, especially when it comes to the birth world. I would say preeclampsia, if this person experiences preeclampsia, if this person experiences even just high blood pressure, they don't even have to have preeclampsia. If the person goes in early for a C-section and then they've got they've got a round of antibiotics, perhaps they had antibiotics in pregnancy, perhaps they had gestational diabetes, perhaps they fell during pregnancy. These are all things that I'm like, okay, I'm going to see what the effects are on this baby's body.
And mama too, right?
Oh, and mama too, absolutely, because baby is mama.
Yeah. I just want to make sure that we are on the same page. Yeah.
Absolutely. And so sometimes treating baby treats mama, and sometimes treating the mom treats the baby.
Yeah. I've seen that.
So we have to look at them as a pure dyad.
I have a quick question. I've always wondered where the dura fits in. Is that classified as connective tissue, or is that its own classification?
Well, dura is fascia. It's just thicker than the others.
So it's the same system, essentially.
Absolutely.
Yeah.
And it has the same protective mechanisms, and it also doesn't release just the same. So a baby who came out shooting like a cannon, the ones who just fly out,
of those.
Yes, their dura is under duress. It comes out very tight. So that's where this back arching is. So if people don't know what the dura is the connective tissue that surrounds the brain, and the spinal cord that goes all the way down to the sacrum. And if it gets tight, this baby might do a lot of back arching, because when they come forward into their primary curvature, right? So they're deeply flexed, it stretches that dura and it feels painful. It feels like a deep stretch. So go ahead and try to touch your toes and be like, oh, that feels awful. So they're going to do the same. They're going to get away from that pain. So they might do a lot of back arching, these babies who come out really, really fast. Same goes for the babies who have longer than an hour pushing. They will a lot of times get a lot of tension in their dura. This is the one that surrounds the brain. And so for me, when I see a baby who came out really, really fast and a baby who had, 3 hours of pushing, I might see very similar symptoms.
Yeah. That's so fascinating. Well, so let's say that We had a rose petal birth and nobody's worried. And so there was no dystocia and there were no D cells and the baby just gentle birth, whatever, like what most, I think, midwives hopefully get to experience, right? In the latch was okay. Let's say it didn't raise any red flags. In those first few weeks, are there any, you said the arching, are there any other physically visible symptoms? I always consider colic, any baby who's inconsolable needs to be addressed multiple ways, like first by their midwife and then referrals in other places. But what else can midwives and parents be looking for?
Sure. So a baby who turns their head to one side the majority of the time. It doesn't
And
have
likes
to
to sleep
be,
facing one way.
yes,
Yeah. Mm-hmm.
always to one
Mm-hmm.
way. That is something that I'm like, we could, depending on how deeply set it is, it's usually something we can help with within 1 or 2 sessions of cranio.
Yeah.
The other one is if they're really grunty. So they're really,
Hmm.
really grunty, they're gassy. There are lots of different reasons why a baby might be gassy or grunty. It could be slow digestion. It could be that they're swallowing a lot of air. And I don't think that there's any harm in trying to optimize these. So sure, they're not, the parents are like, well, it's not that bad, And I'm like, oh, I get it. It's bad. There's no harm in making it not bad at all.
Better. Yeah, right. Yeah, definitely. Totally.
So the babies who don't poop every day, that's saying that, oh, well, they're breastfed. I'm like, no, nope. That is a sign of slow digestion. And let's get to working on that. There's, again, no harm in making it better. Or the babies who always have a smear in their diaper. They're just constantly working on a poop. That to me tells me,
Mm.
again, they are not consolidating their poop, right? So it's just constant. They're just constantly working on it. So little shards.
Yeah, or does it speak to sphincter control at all? Like it because that goes through a fascial process?
It could go through, it could be sphincter related, but a lot of times these parents are like, I mean, they're always going,
Ah, okay.
so that to me tells me they're using
Okay.
compensatory muscles to move the
Oh, okay. 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 That's smart. Yeah, got it.
Mhm.
Mm-hmm.
Right. So our
Okay.
our intestines are involuntary movement controlled by the vagus nerve and many other
Mm-hmm.
things. But if this baby is using their abdominal muscles to move the poop through, then what's happening
Mm-hmm.
with that vagus nerve? Are the signals not fully functioning? And
Mm-hmm.
a lot of times it's even minor, unnoticeable torticollis that can cause these things. Also, babies who were at any point after, let's say, 20 weeks, so between 20 and 32 weeks, maybe even 34, because sometimes they could turn, if they were breech at any point in that time, I call it the breech spot because it happens all the time. And I will ask, does your baby breech at any point? There is the junction between T12 and L1, and within that lumbar spine, if there's any like fascial restrictions, it can throw off the digestive system. And so call it the
Oh,
breech spot.
wow.
And a lot of
Wow.
times they're gassy and grunty. They don't like being on their backs, or if they are on their back, their legs and their knees are really hitched up. They stay, really deeply flexed for a while because their back hurts if they extend, because something, there's a vertebrae out or something like that. And that's why chiro or osteo is really helpful as well because they can help with those joints. So another sign would be this baby doesn't like being on their back or on their tummy, right? So as soon as they're like, oh, my baby doesn't like being on their tummy, I'm like, okay, why? Is there something in their front body that's
Yeah,
hurting or something in their back body that's hurting? This is to me indicative of fascial tension somewhere. And then if they're on
that
their
makes so
back,
much sense.
again, fascial tension, or sometimes if the collarbones, if they had any issues with their shoulders or anything like that, if the muscles here are tight, actually they can get vertigo. So as soon as you even just like start to lay them down to go on their backs, they'll start getting the spins. This happens with, children, adults, the same thing. So if they don't like being put on their backs or they, even just the act of lying down sends them into crying, I'm like, okay, well, what's happening with their collarbones?
Yeah, I also feel like that need to co-regulate where they can't ever be laid down. Like they have to be
There's
constantly
that too.
on mom. I find like there's cranial is my highest referral for that because it means that there's some disordered function there, you
Yeah,
know.
and it could be their experience with being born, however they were born. Perhaps they're still kind of replaying the events. And so they need to feel
Yeah.
safe.
Yeah.
Sometimes they're in pain, and the only way they're out of pain is when they're getting this oxytocin from their parents. And
Yeah.
and sometimes they're stuck in fight or flight, which is very common
Yeah.
because they cannot regulate on their own. So they need that co-regulation.
Well, I find that we don't see it in midwifery practices almost at all, but in obstetric practices, they're so quick to cut the cord, and there's a ton of adrenaline circulating, mom's adrenaline that crossed the placenta that's circulating in baby at birth, that if that doesn't get a chance to be pushed back to mom for her adult liver to process it, those babies are particularly cranky. And we don't see that much in midwifery practices anymore, but that's definitely something that I correlate with that prolonged fight or flight is oftentimes because the newborn liver can't process that adrenaline.
Yeah. And higher levels of cortisol as well. Cortisol is another thing
Yeah.
that the liver has to process.
Yeah, it's so fascinating. Well, I want to zoom out for a second and take us to the adults who are listening. And I would just love it if you would make some connections, because one of the things that was one of the most profound learnings in my career was about how chronic pain is oftentimes related to those early birth injuries that never get addressed. And I wonder if, first of all, do you agree? And second of all, what does that look like in your world?
First, I 100% agree, because I'm a massage therapist. I'm looking at the body on the table, and because I'm also a massage therapist and cranio for babies, I see very similar patterns of holding, right? And so I'm like, oh, I think I know how you were in utero, especially if they've got one hip higher than the other, if they've got one leg longer than the other, same thing. They lay down and their head turns to the left, right? And they feel the most comfortable with their head to the left. I was like, oh, you got some slight plagiocephaly, huh? Because we develop in the womb,
The
and
jokes that are only funny to us, right? The jokes that are birth worker humor should be a whole page. Yeah, exactly. Okay, go ahead. Sorry, I didn't mean to interrupt.
And again, it doesn't have to be trauma. It's just the way our body develops in utero, in the available space, right? And those patterns get stuck in us because we're humans. That's what fascia does. However, sometimes those patterns don't serve us. So a baby who had plagiocephaly or torticollis might then later develop things like scoliosis, and not structural scoliosis. That's the very severe one where the bones really, really shift and are significantly, let's say, deformed. I'm talking the functional scoliosis, the one where it's like, I've got one shoulder a little bit higher than the other, or, that type of thing. That is the same holding pattern that your body had developing in utero. And a lot of times those babies also didn't crawl very well or for very long, or perhaps they crawled with one leg. And again, that's brain development. So brain development then goes into, I'm very right-sided, I use my right brain more than my left brain. And so how we develop as an infant directly affects how we are as an adult. But chronic pain, let's say you do have one leg longer than the other, that one leg is going to throw off your fascial systems, the fascial lines within your body, and it's going to put strain on, let's say, the opposite side a little bit more. And then you're going to have more wear and tear on, the left side, your left knee, your left hip, those types of things. So I'm not saying that we can you're going to be completely symmetrical if you get cranio. No, that's not what I'm talking. We're just going to help with, decreasing the difference between side to side. And even when it comes to an adult, when you do have, these asymmetries in your body, your bones have pretty much formed now, especially if you're past 25, your sacrum is fully formed. And so there's only so much we can do structurally to help with these types of things. However, our body is incredibly capable of compensating. And that's where a lot of the chronic pain comes from. So we can help to loosen up these fascial tissues so that they move a little bit better, and your other parts of your body move a little bit better, and decrease some of this chronic pain.
Yeah, let's have more of that. That sounds great. I'm like, I gotta see someone right now. I feel it in my body right now.
Yeah. And you know what? And so I would also talk to the people who are pregnant, people who are, thinking about getting pregnant, is what injuries do you have in your abdomen? What previous injuries do you have in there that could be limiting the amount of movement your uterus has? So I'm thinking like round ligament pain. I'm thinking, a lot of people are like, oh, I've got it so bad on one side, right? So, okay, so you've got a shift in your pelvis. How can we help, bring back just a bit of symmetry? I'm not talking complete. How can we shift your body so that, the weight is distributed evenly side to side? How
Yeah.
can we
Bring the
prep
functionality
you?
back.
Yeah,
Mhm.
exactly. How can we prep your body and help your baby get into a really good position by loosening up some of the stuck fascia, even surrounding
Yeah.
the uterus itself?
Yeah, and that is a big work that a lot of people know. Nicole Morales and Gail Tully and Molly, what's her name in Ireland? There's some really great folks who are really, really focusing on what the physiology, the fascia, how it plays a massive role in the position of the uterus, the position of the baby, the shape of the pelvis, and of course, obviously the function of the labor. But you're saying even before then, like way in pregnancy or even pre-pregnancy, saying, how do I feel unbalanced? And wouldn't I love to get more balance before I'm carrying a heavy uterus or a heavy baby?
Correct.
Yeah, yeah. That's so great.
Yeah.
Well, probably folks are aware of this, but let's just give them a little tidbit anyway. When like let's just say that lead us through like some symptoms that like you said they sleep with one head to the side, one hip pain or leg longer. Is there anything else someone could be looking at and be like, I should get myself to craniosacral?
You mean for the adults?
Yeah, let's just tell them
Yeah.
like a little. Yeah.
Okay. So I would say if you had pretty big injury in your teens that you maybe did some physio for, probably you should go get some cranio.
Okay.
Let's say you had traumatic experiences, either physically or emotionally. Those could be stored in your body. That is, that is your baby's first house. And what can we do to help bring some healing, some light, or release things in that area so that this baby comes into, let's say, emotionally lighter area, home? I would also say things like a car accident, maybe sports. You were heavy into sports and you have these repetitive strain issues, that can throw off your body a little bit. I would also say the people who are into weightlifting or doing a lot of
Mm.
exercise, this can really tighten and cramp the space, limiting the amount of space this baby has or decreasing the chances of them getting into a nice position. Those folks should also see pelvic floor specialists for some internal work would be great. But cranio
Yeah,
is
yeah.
also wonderful. Yeah.
We have a great episode on pelvic floor therapy. We'll link below because it is such a
Oh,
such a
yeah.
powerful referral too. Yeah.
Absolutely.
Yeah, yeah.
And the other one is
Yeah, yeah.
migraines. So,
Ooh, tell us more about this. This is fascinating.
mhm,
Tell us more. This is that Dura
yeah,
again, right? Like
that's the
so
dura
so tell
again.
us more about that. Yeah.
Yeah. So anyone who experiences either headaches, just like recurrent headaches or migraines, a lot of times there's either intracranial pressure. So there's excess pressure in your head that just boom, 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 right? And that's usually because there's poor drainage. It could also be because the fascia is tight either around your brain, it could be tight in your neck, it could be tight for the lymphatic system, so it doesn't drain very well. And so if you experience headaches pre-pregnancy, boy, don't you think you're going to get more when you are pregnant? And that's because, excess blood and there's more fluids. And so more fluids in the body equals more fluids in your brain
Mm-hmm.
and an increase of headaches. So when you come to see a craniosacral therapist, what they can do is they can help with that drainage. That's
Yeah.
literally what we do. We can do some pumping of your head to help with the drainage. First, what we'll do is we'll release in the shoulders, the collarbones, the neck, beside the ears. First, we'll do that so that when we do, help with drainage, it actually can flow through the neck. So this is where the fluids flow back into the bloodstream is through the neck here. So we can even take some pressure off individual bones within your skull. So perhaps, one bone is really stuck, and so it can't move and grow and expand and shrink and with the craniosacral rhythm. And if it's stuck, then that can cause, headaches and that type of thing. So we go in, we release these areas, we can release the dura, we can release the fascia in the ears even, and we can release fascia around the nerves that go to the tongue, throat, and mouth, that if you're clenching your jaw a lot, we can loosen completely go away, but we can loosen those areas to make life just a little bit easier.
That's awesome. Well, I want to shift gears before we end today, and I want to ask you about folks with connective tissue disorders like Ehlers-Danlos or hypermobility. Tell us about this in the context of craniosacral.
So because they are hypermobile, they don't do well with like overstretching. However, their fascia still gets tight. So their ligaments and they do overstretch, but again, it's protective tissue. So they overstretch and then they overcompensate for that overstretching. And again, this can cause pain. So I believe that with Ehlers-Danlos, they have that super stretchy phase. And then as they get older, they get into that super stuck phase, right? And because we're not overstretching, so ligaments are fascia. They're a type of fascia, right? And so because we aren't overstretching, we're able to loosen these areas without damaging them.
Yeah, it might be
we're
the
not
perfect therapy, right?
precisely. And people with EDS are also often not believed. So there's a lot of emotional aspects to it that we can also address.
Yeah.
And we'll believe you.
Yeah. Totally. I have another question. This is a little, I don't know what it is, but we're going to charge right into it. Okay. So I have the concept that visible cellulite is fascia.
Mm-hmm.
Is that true?
That is true. Yes.
So can you explain how that forms? Like, I understand it as like a net or a web that is really tight. And so inner tissue is kind of poking through those little like lumpy bumpies. Is this what you know to be true too?
Yes. Yes. That's it.
Aha.
Yep.
Okay. So one of the like interwebs foremost talker teachers about this is Ashley Black, and she created the fascia blaster. Tell me your take on this. Do you know about this? You know what I'm talking about?
I think I've seen videos recently of her fascia blaster. Is she the one who's like rubbing her thighs with this thing?
Yeah, it's basically like a claw, and you're supposed to like attack your fascia. I don't know exactly the whole thing, but I just saw this in preparation for us talking, and I was like, I wonder what you think about this.
Okay, so remember that fascia is reactive. Yeah?
Right. Ding, ding, ding.
So
Okay.
yes, it's reactive, it's protective. So I haven't done my own studies on it, so I am purely talking from speculation, is that you are forcing the fascia to release. So you're like, stop it, fascia, stop doing the job you've been doing this whole time and do what I tell you to do. And the fascia's like, no, thank you. I'm going to do something else. I'm going to tighten. So I don't know if it's a mixture of releasing the fascia to the point where it then reacts and tightens further, or releasing it to the point where it's too loose. And now you've broken bonds, you've broken this fascia. So I'm going to say it's probably
Both could
not a
be true.
direction I'll take.
I don't, yeah.
Okay. Both could be true.
But it's fascinating, really. I love that you keep reminding us fascia is reactive, fascia is emotional, fascia has this connection to your mind, body, spirit world. It's a holistic organ. It's a part of every part of you, right? And in fact, when you're talking about, I'm going to switch subjects here. I'm sort of a all over the place kind of a girl, but when we're talking about folks who are dealing with the somatic experience of their PTSD, it is oftentimes the fascia that is causing that somatic pain, correct?
Yes. And it's often when we touch these areas that we have those somatic experiences. So when we access this, we access the memory, we access the trigger, we access the experience because of those memory cells.
Yeah, because they're stored, right? I mean, Bester van der Kolk, right? The body keeps the score. But I think what's so fascinating is that craniosacral gives us this access to it in this hopefully non-threatening environment, right? We're not fascia blasting. We're 5 grams of pressure a holding, which is a very different experience in the body. And so, I mean, again, that reminder that it is this felt emotional space that, of course, how it is even touched, held, addressed would change how it responds because it's reactive. I'm just repeating what you said, but it's like really, I'm getting it. It's really going in really deep. I love it. Thank you.
You're welcome.
Yes.
Yeah. And I want to say also that the good craniosacral therapists are not the ones who are going to bring you to your absolute edge of this experience, of this trauma. That is not where if they are trained properly and they do what they are trained to do, we don't bring you to your edge of that experience. We don't. They used to in the 70s and 80s, and it was like, oh, look at us, I'm re-experiencing, I'm feeling all of the biggest emotions, I'm scream crying, and this is the only way that I can get over what I experienced. We've actually come away from that. In the craniosacral world, somatic experiencing is kind of going there, and they're just like really, really into it. And that's fine if that's your healing, but that's not everybody's type of healing. So cranio, if they are trained well, they will bring you to taste it, right? They'll just give you a sneak peek at what you experienced and then bring you back and allow you to experience it a little bit more and then bring you back to safety. And this gentle, I
because if you
believe,
flood the nervous system, it's reactive, right? I mean, you could even
re-traumatizing.
re-traumatize. Yeah, I get it 100%. And it just sounds like, obviously I can see how much you work with newborns, because if we imagine that every adult that we're sitting with was once a newborn, like
Absolutely.
you would never thrust a newborn back into their birth trauma, right? You would just be like, I saw that you felt this and you're safe. And I saw that you felt this and you're safe. Like, right. It's a taste and a return to normal, so that repatterns the system. It's just brilliant. I'm just enjoying you. I'm
I'm
great.
glad. Yeah. And I will say that there are some, I will not say what they are, but there are some healing modalities where they say, especially for newborns, it's okay if they're scream crying in your session. That's them releasing their emotions. And I have the absolute opposite opinion, where there is no healing in
Yeah.
fear. And so why re-traumatize this infant? Help them, they can get a sneak peek and then let them know that they're safe. Get them a sneak peek, let them know that they're safe. And this way of helping babies re-experience their birth in in like a taste at a time has been a really easy way for me to help these families with babies who are just constantly on edge. Help bring them down.
Yeah.
Bring them down from that
Because you're
heightened.
actually creating safety.
Correct.
And that's the goal. Yeah.
Constant, right? Like repeated
Brilliant.
safety, not just
Brilliant.
one
Yeah.
moment
Yeah.
safety. Yes.
Yeah. I mean, I don't know if you speak in the world of like perinatal psychology, but this would be experiencing blueprint instead of imprint.
Correct.
You know, it's,
Yes.
yeah, you speak my language. I get you. I get you.
Yeah.
Well, Meaghan, it's been really a real pleasure to learn from you and connect with you around this. I have the recommendation that all of our listeners find their local craniosacral therapist and take them out to lunch, take them to have a coffee. How would you like to be approached if somebody in your neighborhood was like, I deal with moms and babies and I want to know more about what you do? How would be the best way to reach out to you?
Absolutely. Ask me for a coffee. I will go.
Yeah, totally.
I'm on
Exactly.
Instagram. I'm in
Oh
my
yeah, how can
DM.
people follow you specifically? But we have a global reach, so I just always want to tell people,
Yeah.
like, go find a craniosacral in your area. But then specifically, people might want to follow you for education and inspiration. And how can they follow you specifically?
So I'll talk to the first one. How can you reach out to your local craniosacral therapist? Here's the thing. Not all craniosacral therapists are created equal. So it would be very important for you to find the type of craniosacral therapist that jives with you, right? Like you have to resonate with this person. If you are not in that mind frame of somatic experiencing, then perhaps go to someone who doesn't do those types of things. If you're in a mindset where you're like, I want to experience all of the things and I want ethereal and I want all of this, find that person. Their language will be on their website. If they don't have a website, then ask them. Then be like, hey, are you into biodynamic? Biodynamic is very much, watch and hold, witness and wait. Cranio for biomechanical is more, what can I do to help you to change? So depending on what resonates with you, choose the one that resonates with you. So biomechanical, which is like pleasure type style, biodynamic, which is, I don't know it very well. Body intelligence is the other one.
Okay.
I don't
Yeah,
do
that's okay.
biodynamic.
Yeah, no, these are good advices. Yeah.
Yes.
Yeah.
Yes. And so
Look
it just
carefully.
depends on,
And then I always recommend get on their table, right? Get on their table yourself.
Absolutely. Absolutely. And
Yeah, pay for a session.
try at least
Yeah.
once. Try someone once. If
Yeah.
you're like,
Yeah.
try another person once. Try another.
Yeah.
Because again, they're not all created equal. And if you only have one within your, general reach, if you're, the closest one is 6 hours away, then I don't know what to say.
Well, here's one thing. What if somebody wanted to become a craniosacral therapist themselves? How would they go about getting the training?
So that is the second part of that little piece, is that I do train health professionals how to do craniosacral therapy for babies, from newborn up to 12 months. And within that training, I do very general also for the adults, right? So it's general training for the adult body as well. So they could take this training themselves, which my website is beamescst.com. So Beames is BEAMES CST.com. My first 2 levels are virtual. I teach you the very basics of cranio for the human body and the infant body in the first 2 levels. And then if you are like, oh, I'm serious, I actually want to be a craniosacral therapist, then you can do the in-person, which is our level 2, and we go all the way up to level 4. So you can come and do in person as well and become an infant craniosacral therapist. Yeah. So
and is that only in Toronto, or do you travel?
So I also travel. It's the majority of them are taught in Toronto. Once a year, I will travel out of Canada. This year, I'm going to Ireland in the summer. We'll be doing a level 2 and a level 4. Yeah, I'm pretty excited. Level 2 and level 4 in Ireland, and the rest will be in Canada. And so I have people flying in to Canada from all over. We've got people from the US that come in. That's people from Jamaica, from Indonesia flew in, people from Ireland flew in. So it is an international group of people. So much fun.
That's so great. And then we got your website. You're on Instagram. Anywhere else
I'm on
folks
Instagram.
can follow you?
I am going to be starting a YouTube channel pretty soon. That's part of the internet that I'm not familiar with, but we're going to do it. So it will still be Beames. Thank you.
Yeah.
Again, Beames CST. Everything is going to be Beames CST. It's very easy to find.
Awesome. Well, we'll link all that in the show notes. Meaghan, any words of wisdom or last pieces of content that you hope people take away from this? What's the most important thing you want them to know from this combo?
I would say that one session is not enough for babies. I would say you can expect to see someone 3 or 4 times if they're very well experienced, maybe 6 times if they're less experienced. And then when it comes to you as an adult receiving it, if you think that if it's 6 times for a baby, well, you're an adult and you've got years of holding patterns and injuries and emotional experiences. So this is more of like a maintenance thing. Go once or twice in a month for 2 months. And then after that, every 6 to 8 weeks. And
such great advice.
It helps with. Yeah. Yeah. It might help with your digestive system. It could help with eczema. It can help with like work. What do I do with this issue that I'm having at work? And you go in for a session, you might not talk about work at all, but something will come to you and you will be like, this is what I need to do. It's amazing. It's amazing what Cranio can do and what doors can open with it.
Well, with that, a huge thank you for just sharing your wisdom. Really appreciate it.
I appreciate you having me.
Yeah. Till next time. Bye, my friend.